Hello, ladies and gentlemen, and welcome back to session 2 of HCC's virtual conference, which will be focusing on the issue of shaping a healthy food environment, exploring strategies to create healthy food environments, impacting diets throughout the life course. And in this session, we will be focusing on the HCC policy initiatives, which include fiscal policies to make healthy foods available and disincentivize the purchase of unhealthy foods, healthy school policies, which ensure children are protected from the marketing and sale of unhealthy foods in and around our schools, and empowering our consumers to make healthy food choices through octagonal front of warning labeling. My name is Nicole Foster, and it's my absolute pleasure to host today's panel session. I'm Deputy Dean in the Faculty of Law, Cave Hill, UWI, and also a policy advisor with Healthy Caribbean Coalition. And we have a very distinguished and able panel with us today. We have Dr. Anselm Hennis. He is NCDs and Mental Health Director with PAHO. We also have Virloy Lewin, Health Promotion Coordinator for the Department of Health, Bermuda. We have Professor Franco Sassi with Imperial College, London. And we have a representative of the Ministry of Education. We had to make a quick switch from the Chief Education Officer. So we have a representative from the ministry who will be of Barbados, Ministry of Education, Barbados. And then finally, we have Ms. Vanetta Nurse, who is she is Advocacy Officer with the Heart Foundation of Jamaica. So without further ado, because we have a very tight schedule, I hand over the floor to our first speaker, Dr. Anselm Hennis. Dr. Hennis, the floor is yours.
Morning, everyone. Thank you so much for that very kind welcome. Deputy Dean. Let's get the presentation up. Oh, there we are. Good. Thank you so much. Indeed a privilege to be here. So let's go to the next slide, please. Now, suboptimal diet is an important preventable risk factor for NCDs. And to assess risk, a study was carried to evaluate the consumption of major foods and nutrients across 195 countries to quantify the impact of suboptimal intake on NCD mortality and morbidity. Now, you can see in this slide here, the horizontal axis represents food types, and the vertical axis lists countries. The Caribbean is the green bar, which is highlighted by the blue arrow, and it's immediately below the red bar representing North America. So, and there's also a dotted line, which shows the cut points for optimal intakes. So moving from left to right in your screens, you'll note that the Caribbean has the highest daily fruit intake globally. It has a suboptimal intake of daily vegetables. It has a higher than average intake of legumes, which are peas and beans, and a somewhat suboptimal intake for grains, and negligible intake of nuts and seeds. Next slide. So again, moving from left to right, the daily consumption of red meat and processed red meat is quite low, while sugar-sweetened beverages and their consumption is relatively high, and in the harmful range, so much lower than many of the other countries. Trans fat and sodium consumption is close to the normal range, but in fact, total elimination of trans fatty acids is desirable, as it is not a necessary dietary component and is linked to avoidable heart disease, while reduction of salt intake would also reduce heart disease and strokes. So this gives you a panorama of what's happening in the Caribbean relative to others. So let's go to the next slide. And the message really here from that study is that what we eat is important. So in 2017, dietary risks were responsible for 11 million deaths, or just about a quarter of all deaths among adults. Cardiovascular disease was the leading cause of diet-related deaths, accounting for nearly 90% of 10 million deaths among adults. And globally, consumption of nearly all healthy foods and nutrients was suboptimal, and conversely, the daily intake of all unhealthy foods and nutrients was excessive. The high intake of sodium is a leading dietary risk for death. And in fact, diets low in whole grains, and these are source of complex carbohydrates, is in fact the most common dietary risk for death. And these include things like brown rice, whole wheat bread, pasta, barley, and cracked wheat. So globally, 3 dietary factors: whole grains, a deficiency of whole grains, inadequacy of fruit, and too high sodium or salt consumption accounts for more than 50% of all diet-related deaths. And this is very important. Next slide, please. Now, we know there's very little production of food in the Caribbean. Much of what we eat is imported, and is imported processed and ultra-processed foods. And this does not only impact our economies, because the Food and Agriculture Association has projected that the food import bill for the CARICOM region and Cuba will increase from $2 billion in 2000 to $4.5 billion in 2011, and will be as high as $10 billion by 2020. And it not just impacts our economies, it impacts our health. And while many of the smaller islands do not necessarily have the capacity for large-scale agriculture, there must be a recognition of the importance of growing more in the region and also scaling up agriculture for consumption in the region in countries such as Jamaica, Trinidad and Tobago, Guyana, Suriname, Haiti, and Belize. Next slide. The critical importance of the first 1,000 days of life, which is conception to about age 2, and the prenatal and conditions during pregnancy are all linked to risk of childhood obesity and heart disease, stroke, and cancer in middle life and beyond. And it also, in fact, impacts mental health and well-being and development. There's a high prevalence of overweight and obesity among Caribbean children, which is the highest in the region of the Americas. And the message here is breastfeeding, breastfeeding, breastfeeding. Promotion of norms and standards related to the promotion of breastfeeding exclusively in the first 6 months of life and appropriate weaning later on is a key goal of PAHO's work. And Caribbean parents must ensure breastfeeding and optimal infant and child nutrition. So PAHO is working to scale up the baby-friendly hospital initiative in a manner to promote increased uptake and sustainability. Next slide, please. Preventing childhood overweight and obesity is very, very important. And you'll hear more about it, but the importance of the child and school, the importance of the school environment must not be underestimated. Nutrition and physical activity impacts weight outcomes. And in fact, there are clinical studies that show that parental engagement and active parental engagement is linked to better outcomes in terms of weight among children. Nutrition education programs, which are focused, context, and age specific, have been shown to be beneficial in having children obtain optimal weight. And healthy environments for nutrition are key. So school environments that increase healthy foods and beverages and reduce unhealthy junk foods and sugar-sweetened beverages, particularly in school meal programs, and by ensuring that vendors don't sell junk food at the school fence, have been shown to be beneficial. And you must remember that the recommendation is that children have 60 minutes of physical activity a day. PAHO has been leading the development of and promotion of norms and standard and working with ministries of health and civil society organizations. Next slide, please. Much of our work is based on policies coherent with healthy diets, promoting healthy environments in schools and workplaces, and healthy food in terms of shopping, preparation, and consumption. Our work aims to reduce the demand for and offer food and drink products of public health concern, those rich in salt, fat, trans fat, saturated fats, sugars. And we also work on development and implementation of norms. We also work on dietary guidelines, front-of-package labeling, as well as policies which improve taxation of sugar-sweetened beverages and ultra-processed foods. Next slide, please. Now, shoppers have little or no time to find out what they're purchasing and whether it's harmful to their health or contributes to high blood pressure, high blood sugar, or obesity and overweight. And these 3 conditions are responsible for 47% of deaths in the Caribbean. And the underpinning factors are diets high in salt, sugar, and fats. And such knowledge is even more important during the time of the pandemic, given, as you know, the link between NCDs and poor outcomes with COVID. So the goal of front-of-package warning labels is to allow consumers to identify in a quick, easy, and correct way products that are in excess of critical nutrients. These are salt, sugars, and fats. And on the left side of the screen, you'll see that there are dozens of systems, but you'll see the octagonal warning labels. And these have actually been shown, and they're in the middle side, to be the most effective system to inform consumers. On the far right, you'll see the information about this randomized control trial that was conducted in Jamaica, which showed that this, again, is the most effective way to inform consumers who have the right to know about what they're buying. Next slide, please. We are now at the last stages of a process led by CrossQ to develop a standard for front-of-package warning label. The final draft is being prepared, and the member states are deciding what to do. Next slide, please. Basically, sustainable food production must be recognized as a regional priority. Control of childhood obesity requires appropriate nutritional support, including breastfeeding during the first 1,000 days of a child's life. We must safeguard and protect the school environment and promote nutrition and physical activity. What we eat matters. Suboptimal intake of 3 dietary factors, namely whole grains, fruits, and sodium salt, account for more than 50% of deaths due to dietary factors. Front-of-package warning labeling is an evidence-based method, and the octagonal-shaped high-end system is supported by robust scientific data from the Caribbean, and it empowers the consumer with the right to know, facilitating informed choices. Thank you so much.
And thank you, Dr. Hennis, in particular, for respecting the time limit. So you're bang on time. So you've set a high bar for the rest of the panelists. And so without further ado, I hand over to Virloy Lewin, who will speak on the Bermuda experience.
Good morning, everyone. Thank you for the opportunity to be here to present on the Bermuda Sugar Tax. I'm going to just give a brief overview of the sugar tax, and then Professor Sassi will talk about the evaluation of the sugar tax. Next slide, please. Next slide, please. Okay, I will go on.
You can just jump ahead, just go along, and I'll speak on the back end to the
Okay, sure, no problem. So just to talk about the Bermuda situation, the incidence of type 2 diabetes, heart disease, hypertension, and cancer has risen in tandem with the weight of the population. In our 2014 Steps to a Well Bermuda survey, we found that 75% of adults were overweight or obese, and 13% of the population were affected by diabetes, and 50% of our population drank at least 1 sugary drink a day. So the aims of implementing the sugar tax was to fulfill this throne speech initiative in September 2017, and also to raise awareness and start the conversation around healthy eating, and act as a deterrent to purchasing sugary items, and a catalyst to create a healthier food environment, and also provide financial support towards enhancing health promotion and education for the community. So the sugar tax was rolled out in 2 phases. Phase 1 was effective October 1st, 2018. And phase 1 saw duty on certain items move to 50%. So for example, cane or beet sugar and chemically pure sucrose in solid form moved from 0% to 50%, and there are some others as well that moved up to 50%. Concurrently, duty was lowered on selected healthy foods. It's lowered to 0% on foods such as chicken eggs, potatoes, cauliflower, broccoli, oranges, and apples. The phase 2 of the sugar tax became effective in April 1st, 2019, and it increased the duty from 50 to 75% on those previously affected items, and added additional items such as cocoa, chocolate food preparations as well. So where are we now? Overall, the rise in the cost of grocery basket items post the sugar tax implementation is about 25%. There were conflicting reports in the retail sector and some unexpected trends seen, and hostility experienced at price increases following in-store sales. An omnibus survey showed that sugary drink consumption was 42% in 2019, which was a reduction from 50% of adults drinking 1 or more sugary drinks a day in 2014. And also the sugar tax raised over $5 million between October 2018 to December 2019. So that's just our background of the sugar tax, and I'll now pass it over to Professor Sassi for the evaluation.
Professor Sassi, feel free, go right ahead.
Thank you very much, and thank you, Virloy and Nicole. If I may have the first slide of my presentation, I think Dr. Hennis has made a compelling case for addressing issues of poor nutrition and obesity in the region, and Dr. Lewin has made has provided a very clear description of the rationale and the characteristics of the sugar tax in Bermuda. May I have the next one, please? But why is the sugar tax in Bermuda so important? And as an example for the region, the sugar tax in Bermuda is important because it's designed in a way that is not standard for a sugar tax, for a tax of that kind. First of all, because it's an import tariff. It's based on import tariffs, which is unusual, as I say. But it's of course due to the characteristics of food supply in an island like Bermuda. And the second aspect is that it doesn't hit just sugar sweetened beverages, but also targets a broad range of foods, and it includes that's an important feature, a reduction in taxation on a number of food items that are viewed as being healthy. I'm not sure if the presentation can advance. Perfect. Okay, so I won't describe. Could you go back to the previous one, please? I just want to. I won't describe the tax because it's already been described. But in terms of the evaluation that we carried out at Imperial College, it included two components. One was a qualitative component in which we carried out a survey of the Bermuda population via telephone, and we interviewed a number of stakeholders. The survey revealed that there was a very high awareness of the tax in Bermuda, but not everyone thought that the tax was the best way of incentivizing people to make healthy choices in their diet. The interviews with stakeholders, which covered a very broad range of stakeholders, highlighted a number of tax design issues that could be improved, and I'll touch upon some of those in the rest of my presentation. Then we did a quantitative analysis. We looked at data from one large retailer in Bermuda, and we looked at how consumption and prices of products that were subjected to the tax changed over time, particularly focusing on sugar-sweetened beverages. May I have the next one now, please? So from the quantitative analysis, I'm just going to present, short of time, of course, so I'm just going to present some highlights. So this is one of the most important findings. What you see in the black line there is the prices of beverages that were taxed, and what you see in the blue line is the prices of beverages that were not taxed over a period of 2 years that covers the introduction of the two steps of the tax, which you see with the two red lines, the two vertical red lines in the diagram. So what you should note in the first place is that the prices on average of taxed beverages, or the beverages that have added sugar, are significantly lower than the prices of the non-taxed beverages. And the other thing that is important is that over the period in which the taxes were introduced, there has been a substantial increase in the price of the taxed beverages, which made the prices of taxed and non-taxed beverages converge, although they're still, the prices of the taxed beverages are still somewhat lower. So we measured the contribution of the tax to the increase in prices over that period of time, and we assessed it to be 26%, which is very much in line with what Dr. Lewin was saying earlier. May I have the next slide, please? So the 26% increase in price was matched by a response by consumers, which was roughly equivalent. So we estimate that consumers have reduced their consumption of sugar-sweetened beverages by about 26% over that period of time. Conversely, the tax reduction on fruit and vegetables was not effective because it was too small in size, and there are big fluctuations in the prices of fruit and vegetables over time that are far larger than the benefit that the tax reduction has produced. So there are features of tax design that could be improved, and they could be leading to a much better impact on public health. May I have the last one? So in terms of lessons for other countries in the region, the main lesson is that taxes, even in a small setting like Bermuda, which is similar to other countries in the region, taxes can be very beneficial. They can work even if used in the form of import tariffs, but they need to be accompanied by good communication in terms of the products, communicating to people what the products are that are covered by the tax, how the revenues generated by the tax will be used by government, which has been a critical point in Bermuda. And you also need to increase awareness of people's awareness of the health rationale for the taxes, so that they can be, sensitized to improving the food choices beyond, what's driven by price incentives. And also from a structural point of view, the tax can be improved, first of all, by increasing the size of the incentive on fruit and vegetables, possibly by introducing subsidies in addition to tax reductions. There needs to be a regulation of price promotions that often can offset the price increases due to the tax, and this is particularly important on sugar sweetened beverages. And there need to be complementary policies that can help to create food environments like healthy food environments, for instance, policies that reduce the prices of non-sugar substitutes. You've seen in the graph earlier that beverages that were not taxed at a higher price overall, and policies that regulate the availability and promotion of affordable and healthy options. So I'll stop there. I'm happy to take questions if there are any.
Thank you very much, Professor Sassi. And with that, I hand over to Heather Phillips-Boyce, who is Education Officer in the Ministry of Education, Technology and Vocational Training, Barbados, to share a bit of the Barbados experience in terms of our upcoming school nutrition policy. Mrs. Phillips-Boyce, you have the floor.
Okay, thank you, Chair. Good morning, everyone, and I thank you for the opportunity to share. I must present a disclaimer. I am not Ms. Joy Adamson, as Chair stated, but I am representing the Chief Education Officer of the Ministry of Education. So the focus will be for these 8 minutes on the National School Nutrition Policy. So Barbados was thrown into a spin like the rest of the world, where our students were taught virtually. And like many students in the world, they were engaged in sedentary lifestyle and overeating. For a matter of fact, it was compounded during the time that we were on lockdown because of the COVID-19 pandemic. So back in 2017, we got some data which stated that 1 out of every 3 students is overweight or obese. And anecdotal evidence, I'm sorry, it's not empirical evidence, but anecdotal evidence reveals that our children are contracting type 2 diabetes and elevated blood pressure. Now, type 2 diabetes and elevated blood pressures are diseases that young people should not be contracting. So the government of Barbados spent $63 million on treating cardiovascular diseases and diabetes in 2017. So if our young people are contracting type 2 diabetes, you could only imagine what that bill will be like in the next 10 years. So the purpose of this policy is to ensure that students are provided with a food environment that is safe and that healthy eating is supported and encouraged. And the Ministry of Education will also like to ensure that all aspects of physical activity in schools are promoted for health and well-being of students. Next slide, please. So in designing this national school policy, food policy, there was collaboration between the Ministry of Health and the Ministry of Education. But we were given support or supplied with support from the Pan American Health Organization and World Health Organization. There was coordination of the stakeholder consultation process by the National Nutrition Center, and the preparation of the draft was constructed by the National Nutrition Policy by PAHO and submitted to the Ministry of Health. Next slide, please. So when we had these stakeholder consultations, we had 3 sessions. So session 1 was mapping out of the obesity NCD challenge and presentations by various stakeholders, including civil society. And when we were mapping out these challenges, we recognized that this would not be a very easy task. It would indeed be a challenge. It's always very difficult to change habits. Session 2, we went into small groups and we explored what were the best practices and how could we best reach this change and how to implement the approaches around the policy. And in session 3, presentations by each small group was given, and we had discussions around the various policy positions, which then fed into the draft policy. Next slide, please. So the participants in the consultation were the Ministry of Health and Wellness, including health promotion officers and the community nutritional officers. The Ministry of Education, Technological and Vocational Training was represented by the school meals officers, the canteen concessionaires, physical education teachers, and I must add, food, nutrition, and health teachers. Academia, we had present the UWI from Cayfield campus, the Childcare Board, Barbados National Standards Institute, civil society, the Heart and Stroke Foundation of Barbados, the Healthy Caribbean Coalition, and one youth advocate from the Barbados Child Obesity Prevention Coalition. And of course, we could not create this policy if PAHO, WHO was not involved. So we had a consultant from PAHO, WHO. Next slide, please. So what are our strategies to be implemented in schools starting the new school year? And the Ministry of Education is very focused on implementing these strategies. And we have been collaborating with the National Nutrition Center and the Heart and Stroke Foundation of Barbados, and informing the Healthy Caribbean Coalition of our path forward. So we want to encourage more physical activity among students. Presently in Barbados, we tend to focus a lot on competitive sports. We recognize that not all students are interested in competition. So we want to encourage students who are not involved in competition to get involved in other activities that they consider to be fun. Improve the nutritional value, appearance, and taste of lunches offered by the school meals. The National Nutrition Center, in collaboration with the Ministry of Education, we're looking to see how that those foods can be attractive to the students and they want to consume school meals. That the Heart and Stroke Foundation of Barbados is working with the canteen concessionaires. We have been encouraging that they present to the students healthier options, and we want to sensitize parents about the importance of preparing nutritious meals for their children and wards. The Ministry of Education is zero in on the health and family life education, because we are of the opinion that this can have an impact on how students make choices with regards to food. And we would like to see information on appropriate eating and fitness integrated into other subjects. Next slide, please. All right, so these will be the drivers for the undertaking. Students, most definitely, they have to be educated, and the teachers would be educating the students. So we're in the process of finding out who will champion this cause. We thought initially of the Health and Safety Committee. However, we really need to find those persons who are going to champion this cause, because the process needs to be monitored. Next slide, please. We, like everything else, will have some challenges. There's always a supply and demand. For example, will the school meals center be able to garner the root crops, sweet potatoes, the yams that are required, as opposed to giving the students the macaroni? We have to compare the price, the price of the offerings. The healthier options should be more competitive than the unhealthy options. Students will have to learn to acquire the taste of food. If parents are not accustomed to giving their children fruits and vegetables, that's going to be a problem. A biggie for the Ministry of Education would be the vendors around the schools. That is a target that we are going to be looking at. We need to get buy-in from parents, and there must be regular monitoring. If there's no monitoring, we will fail. Next slide, please.
Mrs. Phillips-Boyce, I think that's a great point at which we can pick up with the end with your aims in our question and answer session.
Okay. We're
at the end of time here, and I'm going to hand over just very quickly to the next speaker, Vanetta Nurse from the Heart Foundation Jamaica. Vanetta, the floor is yours.
Thank you, Nicole. Good morning, everyone. And it's certainly my pleasure to be here today to share our experience in advocating for food policies in Jamaica. Next slide, please. Okay, let me just start by providing a brief background to our project. Our project is undertaken by the Heart Foundation of Jamaica. We are an NGO in Jamaica primarily focused on the prevention and treatment of cardiovascular diseases. The objective would be to increase public and policymaker awareness on the health impact of unhealthy foods and beverages, and to build support for obesity and NCD prevention policies. Those policy priorities you see on the right are aligned to national, regional, and international plans. And of course, they're evidence-based. So front of package labeling, supporting healthy foods in schools, so a healthier food school environment, as well as a sugary drinks tax and restriction of the marketing of unhealthy foods to children. These priorities were selected based on Jamaica's health landscape. So similar to my colleague in Barbados, who would have outlined the increasing NCDs and obesity in adults and children. In fact, 54% of Jamaicans are overweight or obese, and childhood obesity has increased by 68% between 2010 and 2017. We have also seen unhealthy eating practices and, of course, the vulnerability to COVID-19, as persons living with NCDs have a higher risk of more serious outcomes and deaths from COVID-19, and the overall need to provide a supportive environment to encourage healthy eating. Next slide, please. One of our major activities in our advocacy has been our mass media campaigns. So these campaigns are run on television, radio, out of home, so bus stops, on the bus themselves, billboards, etc., as well as social media. Between 2017 and the present, we have had 6 campaigns, beginning with the harms of overconsumption of sugary drinks. So we were starting a conversation and building awareness, as we transitioned to a call for sugar sweetened beverage tax as a health promoting tax. And we had hoped that such a tax would be earmarked for a health initiative or NCD prevention initiative. And our current campaign, front of package warning labels, which is a strong call for this policy on foods high in fat, sugar, and salt, and it's aligned to the consumer right to health and information to make healthier choices. Next slide, please. So briefly, some of our activities, these can be grouped into 4 types of actions. So we do quite a bit of public education and outreach. Even now in the COVID environment, we've transitioned to a more online format. We have developed materials, brochures, just to raise public awareness and to build a discourse in the society. We do have outreach activities in schools, churches, civic groups. We do guest lectures at our local universities, as well as forums and webinars. Our advocacy meetings are primarily with ministers and ministries, departments, and agencies. We are a member of the National Mirror Committee that's currently reviewing the regional standard for the labeling of prepackaged foods, which includes front of package labeling. We provide technical support to advance these policies. We are very active on social media as well with our podcasts, Twitter chats, and some media engagement activities include our journalism training, which is annual in partnership with 3 of our universities here, articles, ads, etc., as well as interviews and letters to the editor, just strongly supporting the policies and providing the necessary evidence to advance them in Jamaica. Next slide, please. Some of our achievements so far include our partnerships with fellow NGOs in Jamaica. So these are primarily health-based NGOs. 18 of them partner with us at the moment, but we have many other outreach partners. Our campaigns have been co-branded with the Ministry of Health and Wellness, as well as partnerships with the National Food Industry Task Force. We also leverage community and civic women's groups, as well as adolescent groups in our advocacy. In January 2019, the Ministry of Health announced a restriction of certain sugary beverages in schools, which we assist with promotion, as well as our campaign helped to spur this action. The school nutrition policy is to be signed off by Cabinet, and we did provide technical support for the development of the policy itself. As I mentioned, we're a part of the nutrition labeling and front of package labeling meetings at our local Bureau of Standards. And we've seen, based on our campaigns, and our contribution to the discourse, we have seen quite a bit of reformulation in the food environment as some companies try to reduce the sugar, salt, and fat in their products to provide healthier options to the consumer. After each campaign that we've had, we do post-campaign evaluations to kind of garner support for policies. So what we have noticed is that 9 out of 10 Jamaicans strongly support front of package warning labels on foods and drinks. 87% strongly agree to support government efforts to increase children's access to healthy foods and drinks. So we're looking at the food environment now. 82% strongly agree on the policy that requires clear warning labels on the front of food packages, and 71% had supported a tax on sugary drinks. And these studies were done with a representative sample of Jamaicans, and we were happy to see this kind of public support, which has certainly advanced our priorities. Next slide, please. Of course, as with any initiative for the better good, we have had quite a bit of challenges. Professor Henry would have outlined the issue of socioeconomic issues that affect access and availability to healthy foods. So we're talking about an overall look at the food system, the social determinants of health. There's also a lack of knowledge of healthy eating practices. We do have frameworks and policies in place. However, specific recommended policy solutions have not yet been implemented. So of course, this will require some amount of political will, resources to monitor, to implement for public education, and processes, especially in the case of front of package labeling and the process we're engaged in now, is not always very clear. There's also a lack of evidence-based decision-making and challenges to existing evidence. Evidence in particular, the situation that we're in now as we face the pushback for front of package labeling, evidence from Jamaica and other countries that have proven that the warning label is in fact the most effective in allowing consumers to make the healthier choices and identifying healthier products. We've seen an increase in marketing and corporate social responsibility, especially since COVID-19. And corporate social responsibility kind of blurs the line between industry interference and what we're trying to achieve here in terms of marketing to children and other activities. And of course, there's been aggressive food industry lobby and pushback. In fact, we have been sued for a part of our campaign where we're providing an image on social media highlighting the sugar content of a particular drink. There has been aggressive food industry pushback against the sugar sweetened beverage tax during our campaign, as well as current pushback for front of package labeling. And in the space, we've also seen delay tactics, as well as some of the regional coordination that would have been mentioned before. Next slide, please. So these are just some examples of the type of, and these are very public examples of the type of pushback that we've been seeing. When we launched our campaign for the Sugary Drinks Tax, we had some headlines in the newspaper highlighting that the tax would cost jobs. There are some issues as well. And the GMA vows to fight to the death against Sugary Drinks Tax. Next slide, please. The ongoing pushback for the front of package labeling, you'll see some examples there, label resistance. The concerns are mainly surrounding trade barriers and objections to the current black octagon label that's included. And of course, the articles on the right show some of our work publicly, but we're also doing quite a bit of work behind the scenes in terms of providing the necessary evidence to advance this policy. Next slide, please. And in terms of the corporate social responsibility, you'll see here the donations that the companies actually provide. We just like to highlight that it must be responsible donations, and whatever is provided should not exacerbate our NCD challenges. Here we have PATH students that are receiving meals, and PATH is a social protection program for children who are in need. So providing these types of meals, you would want to ensure that what is provided is actually benefits the person's receiving and doesn't cause longer health issues.
Okay, so Vanessa, I'm going to have to interrupt at this stage, and let's put a pause here, and we'll pick up in the question and answer session. Thanks so much. So, ladies and gentlemen, we've had a rich and full discussion from showing ranging aspects of this problem, ranging experiences, and we've had a lively exchange in the chat as well. For the next few minutes, what we propose, I will pose a few questions to the panelists as a whole, and we invite some interaction there. So we have evidence to demonstrate that these policies work, but implementation has been slow. And some of you would have touched on it. What have been the main barriers to implementation? And what role do you see civil society actors such as Healthy Caribbean Coalition playing in terms of creating that environment for policy action? Then sort of picking up from where Vanessa left off, what about the issue of industry interference? How much of a challenge has that been in terms of implementation of food policy? And then finally, are SSB tax is really a viable option for Caribbean governments now as they seek to address economic recovery? So I open the floor, and we'll have a free-ranging exchange between the panelists. So maybe we can have an exchange of views first on the main barriers to implementation. Any takers? Or do I have to do like in my class and start calling on persons?
Well, I will start, Deputy Dean, before you call us out. Now, basically, one of the main barriers really is the will of governments to implement these policies. So I think quite often there are relationships obviously, and one is looking at an economy. And therefore, one has to be very sure that, that one doesn't come out as working against the private sector. So we always have an issue in terms of policy coherence. So on the one hand, and we see it in some Latin American countries, where tobacco production is really key to the economy, they believe, whereas the Ministry of Health is saying tobacco is bad for health. The Ministry of Health tends to be traditionally seen to be weak. So therefore, the Minister of Finance is going to listen to the Minister of Industry, who's producing tobacco as a major foreign income earner, whereas tobacco is actually killing the citizens, right? So you always have this issue in terms of economy versus health. And the same thing happens in terms of how the private sector works. The private sector is interested in profits, not in human well-being or human health. So I think there's always an issue in terms of what's most important. When you don't have a situation of coherence, where you can actually improve human health and human capital, which helps the overall economy. And I'll say, for example, in Jamaica, one of the studies we did showed that there's going to be a loss of over, I think it was 80 billion US dollars over a 15-year period, unless Jamaica takes steps to tackle NCDs and mental health. So whereas you may be helping your economy think by what you're producing, unless you do it in a way that is coherent, that puts human health at the forefront, you're actually damaging yourself in the long run. So I'm going to use that as an introduction to this discussion.
Okay, thank you very much, Dr. Hennis. So maybe I might invite Mrs. Phillips-Boyce to share Barbados's perspective, the ministry's perspective on the role of civil society in particular. I saw some questions directed to you on the role of youth in terms of the development of the policy, nothing for youth, without youth, etc. So could you share the ministry's perspective on the challenges of implementation and the assistance that can be had from civil society? You're muted, Mrs. Phillips-Boyce.
Sorry. Thank you, Chair. The Ministry of Education, Technological and Vocational Training has fully embraced all stakeholders with regards to this change. We recognize it will not be an easy one. And I think that we have dabbled with trying to make changes over the years. And I think at this time, we have made more headway than we ever had before. And I think it is because we now have a policy. There will be challenges. Canteen concessionaires who provide meals to the students. The vendors are a biggie, as someone mentioned in the chat. But there is going to be training done for those, call them stakeholders as well, those persons who supply food. So there's going to be education. This education is going to be done by the Heart and Stroke Foundation of Barbados. I'm sure the presenter will mention this. We are going to be educating our students. So we embrace all stakeholders because you recognize that this is going to be a massive challenge that we have in the forefront, but we're working on this challenge together. Chair.
Okay, thank you very much. And I note you've mentioned in particular, for example, the very useful role that Heart Foundation of Barbados Inc. has been able to play, PAHO, etc. So really the Barbados experience really does provide an excellent case study of that type of whole of society response that we need for these types of challenges. If I might turn to invite Vanetta to join the conversation in terms of industry interference. I know this is an area near and dear to Heart Foundation of Jamaica's heart. Unfortunately, you all have had many experiences. And so if you could share a little bit there about some of what we can do to counter this interference, particularly at the grassroots level in our communities, schools, etc.
Thank you, Nicole. I think countering comes at all levels. So the grassroots persons wouldn't necessarily recognize industry interference for what it actually is. So even activities such as corporate social responsibility, while necessary and needed at times, is actually industry interference. So I think it's important for us to bring this to the forefront, highlight it in a way that speaks to the types of food we eat and what's happening in the space, what's happening in our countries, we need to find a way to bring it across to the general public, that not all of this is actually for our benefits, and not all of it is actually going to help us in the long run. It's a very touchy subject, and it's a very difficult subject to bring across, but it's definitely something that we need to do. And in terms of ourselves, from the civil society perspective and the health perspective, really trying to understand the issues that are being brought forward and gathering the evidence that we need to counteract them. I think with the front of package labeling challenges, the process that we have embarked on is not always easy for us as health advocates to understand, because it includes a trade focus as well. Labeling standards development includes a trade aspect, and we have to be able to couch it as a public health issue, a public health priority, while providing the evidence that we are allowed as a sovereign state to implement these actions for the benefit of public health. Trade agreements allow us to do that. So we do need to gather our evidence, maybe a bit of capacity building in our area, providing the information to the public in a way that's acceptable, without demonizing food, but in a way that they can understand that some of these actions are actually not going to help us in the long run.
Thank you, Vanessa. So if I might turn to our Bermudan colleagues now and ask them to take the lead on the question of SSB taxes. We're in a very difficult economic circumstances right now in the region post-COVID. Are we really in a position to be introducing SSB taxes for those of us who don't have it? What from your experience there in Bermuda, what would you suggest? And certainly, what might have been some of the factors that created a climate in Bermuda that allowed for this sort of very ambitious approach to your
Dr. Lewin, I'll let you start the answer.
Oh, okay, sure. Well, now in this COVID era, it may be difficult, but I think the important part is sensitizing the public. I really love what Jamaica did with their campaigns and sensitizing the public to the harms of sweetened sugary beverages. And I think that is something that we kind of lacked in Bermuda, is really getting the message out to the public about the harms of sugary beverages. I think once you get the public on board, it makes it a bit easier for them to accept the tax and giving them healthy alternatives. Also, just transparency on what we're going to do with the taxes that are raised. Because a lot of within Bermuda, the thought was, there's been no talk about specifically what this funding is going toward, and it almost was perceived as a tax grab of money to fund other things. And did it go to what it was funded for? I think those are the two major things, and also the political will to do this. This was mainly because the government really wanted to implement this this tax, and it was a part of their throne speech, and they worked to make sure it happened.
Okay, so Professor Sassi, can you add your views?
I think the best way to answer your question, Dr. Foster, is to look at the period of time when there's been really a big boost in the use of sugar sweetened beverage taxes, and that is the years between 2010 and 2013, which was actually in the aftermath of the last major global economic crisis. So economic crisis also at the government level, crisis in terms of budget deficits and public spending demands. So in the pandemic, there's been a huge amount of public expenditure to sustain the economy. during the most critical months of lockdown. Governments will be desperate in the next few years to find new ways of raising revenues. We can expect a major increase in the use of health taxes because governments have a strong rationale for using these taxes and a great need from a revenue generation perspective. Of course, we all know that the arguments that industry often makes that these taxes cause job losses are completely unfounded, and that there's no evidence that this is happening. And in fact, it's the opposite. Actually, jobs are increased as a result of using these taxes. That is what the evidence says. So I would see this as a great opportunity rather than a risk or a barrier to the use of sugar-sweetened beverage taxes.
Thank you. A very useful and insightful perspective on the whole issue, because you do always get that immediate negative reaction when you suggest to persons that taxation might be the way to go. Dr. Hennis, there's an interesting comment, question from Sandra Granger in the chat. I thought maybe you might be a good person to exchange some comments on that, about the possibilities of a coherent region-wide policy that speaks to, that type of political will that is needed for implementation, with CARFA as a lead. And PAHO has been such a key partner for the region in many of these discussions. I thought you might have some useful views that you could share on it.
Yeah, this is a very important point, the whole issue of policy coherence. And I think very quickly to illustrate, there's a man down a river and he's catching bodies, and the bodies keep piling up. And he didn't think to go at the very beginning and stop people jumping into the river where they're going to drown and roll down the river. And I think quite often we think of health in a very siloed way. Health is here, industries over here, transportation is over there. But in fact, what we need to have a coherent approach across all the sectors in the direction of promoting good health. The greatest asset to any economy is this human capital, it's people, which means health and education. So I think if one doesn't have a health in all policies approach, you're not going to win this overall. The Caribbean sub-region has the highest mortality from NCDs in the entire region of the Americas. What's happened over time is that the situation has improved in Latin America. The Caribbean has not improved, it continues to lag. That is because the policies that promote health, tackling tobacco, junk foods, sedentarism, harmful use of alcohol, these are policies, this require regulations, etc. These are not being implemented in the region at all. South America has just become free of tobacco smoke in public places. So 434 million people are now protected because of this. Only 7 of the 15 Caribbean countries have done this. So we say a lot, but we do not do enough. And I think if we're going to change the situation in the region, move the arc towards human development and development of our economies. Because if people are ill and not functioning, you have presenteeism and absenteeism, you cannot have a competitive economy. So I think we have to recognize the message that we have to move policies to healthier populations, whereas we spend a lot of money in terms of healthcare costs. And I like the point that Professor Sassi made just now about taxes. They're good even in the time of pandemic in terms of recovery, because it helps to get economies back on track. And not just that, those who are most vulnerable are those who tend to take the most of the junk food and sugar-sweetened beverages, which worsens health outcomes. So there are many issues that are interconnected. And I really think that we must move in a way towards policy coherence with a health in all policies approach as the way forward for the region.
Okay, thank you very much, Dr. Hennis. I think that's an excellent note on which to bring the panel to a close. Just a few parting takeaways, and I start where you began and ended, Dr. Hennis, political will being fundamental, but also too, we saw from these presentations the critical role that civil society has played and can play in the development and implementation of policy in these areas. And really all of this speaks to the validity of what we already know, that NCD prevention and control calls for whole of society responses. And that, as someone was saying earlier, not a top-down something, but something from the very bottom up. And I think really that this panel was an excellent complement and continuation of that conversation that we started in the first session. And I end off here with Secretary General Designate Dr. Carla Barnett's recollection that as far back as I believe it was 2001, we understood as a region that our health is our wealth. And if that is the case, we really need to do better when it comes to accelerating our NCD prevention and control agenda. So ladies and gentlemen, thank you very much for being with us. We encourage you to join us in the other sessions during the day, as well as in our individual concurrent lunchtime sessions. I wish you well, and I imagine we may have a little house break or something like that now, so enjoy yourself. Bye.